Let's come to this now. The Democratic Alliance wants a Home Affairs Department to amend the country's critical skills list. Government published a list of critical skills for South Africa earlier on this year. However, the DA says that list does not adequately address the shortage of registered nurses. So let's get some reaction to this from nursing unions, Denosa's Simphiwe, Gada. Simphiwe, thank you so much for your time this morning. Your reaction, please, just in terms of, the DA saying the list does not adequately address the shortage of registered lists and nurses.
Well, good morning to the viewers. Well, we agree that it does not address the adequate, needed number of nurses. However, we think that, updating that at Home Affairs and maybe looking at the recruiting outside the country as a potential solution will not address the challenge that we have. What we need, Tumelo, is that currently in this country we have got a challenge on post-graduate studies in nursing. We've got a challenge on the transformation between, nursing has always been under the South African Nursing Council alone. For those who were training in colleges and those who were training in universities, their qualifications were always accredited by the Council for Higher Education. Now, this transformation has led to a very low intake in terms of postgraduate studies because of the limited number of accredited colleges or universities to offer these postgraduate courses. So as we speak, it's only a limited number of universities as well as colleges that can take postgraduate nurses. But also there's a crisis because the doing away with the old legacy qualifications has meant that we've seen low intake numbers of students to do undergrad studies. So this is a challenge that the country is headed towards, because in the next 10 to 15 years, South Africa is going to suffer greatly when it comes to nurse shortages in this country. I mean, this year when we celebrated the International Nurses Day, this has been acknowledged globally that globally we will be faced with a shortage of about 5.9 million nurses globally. This is due to the effects of COVID, the aging nursing population. And that is why the International Council of Nurses has called on governments across the world to invest in nursing education to ensure that, Council of Higher Education must be assisted and also must also speed up the process of accrediting nursing education institutions so that they can quickly offer postgraduate courses. Right. But also government must invest in nursing so that it increases the intake of nurses into this critical field, because South Africans, if we're to be caught by a second pandemic, unfortunately, South Africa will be caught napping, and countries who are serious about their health system are actively recruiting here at home in South Africa and across other countries that are producing nurses. So we're seeing high volumes of migration because what they've done, they've improved the pay structure of nurses, and currently nurses are leaving South Africa. Unfortunately, in South Africa, our government is not serious when it comes to nursing.
But why do you think that is so, Simphiwe? Why do you think there's no sense of urgency if international societies have already called on for governments to improve on the investment of, the healthcare sector, particularly when you look at nurses, and you're raising an important issue around, training, in-service training, graduates not receiving the necessary support that they need. And you're also, raising an important around, should we be caught in a second pandemic, we will be caught napping. Surely that should send red flags and alarm rates to government. But clearly it hasn't. It's not loud enough. Why do you think they are relaxing on this matter?
Well, it's because of their lack of understanding that whatever money you spend in your healthcare system, you should not look at it as an expenditure, but rather you should look at it as an investment, because that investment in the healthcare system will have positive spin-offs for the economy, which currently we are sitting with an economy that is not growing at the rate that we want it to grow and produce jobs. So if they can understand and have a political will and look at global trends and look at what other countries are doing. So currently we're sitting with a government of the day that is confused, that has got beautiful policies. If you look at the 2030 vision, the NDP, they clearly articulate this matter that we're discussing. But when it comes to the practical steps on the ground, you don't see money going into healthcare system. But also politics, in our view, are also playing, a role that is unfortunately going to see the country suffer, because as we speak, we have had a gap in South Africa where for about 2 to 3 years, we did not have an intake of nurses in our nursing colleges, because there were politics between the Department of Higher Education and the Department of Health, and as well as the Nursing Council, as far as them ensuring that now what we were doing was to align all qualifications in nursing to fall under the Council of Higher Education. So the politics involved there, which also involve the monies that are there when it comes to the training of nurses. So those politics and people simply not understanding what we should achieve for the healthcare system has unfortunately led us into the situation that we're in. And this government, whenever in the near future we face this challenge, they must not act surprised. They must understand that they have also created this situation.
We have to leave it there, but I appreciate you raising this important issue with us. Simphiwe Gada from Denosa, thank you so much for your time this morning.